I'm Dr. Hughes. I'm the Medical Director of Neuroscience Associates at Greenville Hospital System. So when you're talking about the value of exercise, particularly in people living with Parkinson's disease, a number of different areas come to mind. One is patient engagement. This is a disease that's happening to them. This gives them an opportunity to engage and to become much more proactive in their care. The other is the physical. I always say if you take care of the machine will take care of you. People don't die of Parkinson's disease. They die of the medical complications which they may be an increased risk of because of some of the symptoms related to Parkinson's disease. For example, they may have an increased risk of pneumonia because they have trouble swallowing, or they have less respiratory movement. They may have increased risk for blood clots in their legs because they're not moving as much. And so as long as we can maintain their mobility, we can prevent a lot of the long-term complications, which are what really the long-term mortality is. General wellness. We know that exercise really has enormous benefits from a cardiovascular standpoint. People with Parkinson's disease, generally speaking, are in the age group of 65, 70. That's the age group where we start to see the incidence really go up. And so we're talking about a population that's at risk for cardiovascular disease. It's well documented what the benefits from cardiovascular disease and exercise. And because you have Parkinson's disease does not mean that they're any less likely to have cardiovascular disease complications. So it's just as important with somebody with Parkinson's to exercise. Emotional well-being. There have been a number of studies that have suggested and shown that exercise is as beneficial, if not more beneficial, than some of the antidepressants. And so you're really talking about a wide range of benefits that can be seen with exercise. If we use one example, the risk for falls. People with Parkinson's disease have poor mobility, and if you have poor mobility, you have increased risk for falls. You also have increased risk for fracture. It's well documented that the risk for medical complications once somebody has, for example, a hip fracture goes way up in the next year. And so if we can prevent that, exercise not only helps strengthen the bones, but exercise can also help improve balance. So you're getting more than one benefit from actually being very active in exercise regimens. It's one thing to tell somebody they should be exercising. The second thing is to make it available to them. So how do you exercise when you have problems with your balance, you have limited mobility? Not only find a regimen that you enjoy doing, but probably more importantly, do it safely. And so that's one of the real advantages of this exercise regimen, is that people can exercise safely. The risk of injury if they get off balance is much minimized because of the design of the equipment. So when I was first introduced to Speedflex, I have to admit I was a bit skeptical. I came over in heels to kind of see the equipment. And while I can walk in heels, I certainly don't think I can exercise in heels. And what really impressed me was the safety when pushed to demonstrate what I could accomplish in my heels, which I think is the closest that I can equivalent what somebody with a balance problem would have. It gave me a real sense of what the potential for it is. Now, I'm not advising people exercise in heels, but I think that that gives you an example of saying that if your balance is off and you hesitate or you stumble, that the equipment's not going to come crashing down on you. And once you have that comfort level, then you also have that comfort level to push yourself to the next level, to continue to advance. When somebody is exercising, that the safety that's intrinsic, that they're holding on, that the weights are managed however that occurs, so that things don't come crashing down on patients. It's a very unique design, and I think it gives people the opportunity and the sense of ability to continue to push themselves past what they ordinarily would expect them to do. We tend to treat people very tenderly and have lowered expectations for people who have Parkinson's disease. This is good enough. And what we're really saying, is this good enough, or can we push you to the next level? And if we do push you to the next level, working with you, can we support you and have you in that environment which it is possible? I have a couple of patients who have been through Speedflex, who are continuing exercise with Speedflex, and I think particularly from Parkinson's standpoint, one is the improvement in gait speed and stability. There was a gentleman that I had referred for speech therapy because one of the symptoms of Parkinson's is low speech volume, and I thought he'd been to speech therapy, and he turned out he never had gone. He had just started exercising, so his ability to project his voice had improved just with exercise. I think the other thing that was really remarkable to me is the level of confidence that people achieved with being able to say, I'm exercising, I'm proactively caring for myself, and that has made an enormous difference in quality of life. So the question of, is exercise complementary, is it alternative, I think it's mandatory. When we're talking about medications, we know that they have limited roles. And there have been examples of people who have been able to exercise and have decreased the amount of medication that they required. Certainly very interested in continuing to research that in the future to see that as we exercise, do we require the same levels of dopamine, which is a neurotransmitter that's deficient in Parkinson's disease? Can we supplement that in a different way? I don't think it's complementary. I think it's a mandatory. It just sort of suggests that it's an option, where I think it's actually something that should be required. Some of the traditional exercise regimens that have been recommended for people who have neurologic disorders like Parkinson's disease, one has been aquatic therapy. The old caveat that if you fall over, you just splash. Not everybody likes the water. It tends to be more of a geriatric-driven program. And you know, if you're a young, healthy male, the idea of being able to work out with weights, quote unquote, versus being in the pool with old ladies, it has a whole different kind of sense of what that means to people. I'm not minimizing aquatic therapy in any way. That is an important option, but water's not appropriate for everybody. Yoga is another exercise technique that's been recommended. It has a whole different feel from working out on exercise equipment. Both, I think, can be very important. But I think one of the things that we really have to recognize is the only exercise regimen anybody continues is something they enjoy, and that there has to be this match between the personality, what that person really finds fulfilling, and the exercise regimens that are available to them.